Making the right referral for somebody that is experiencing mental distress is important, because this could be the difference between somebody sustaining their tenancy and somebody not sustaining their tenancy. You don't want it to escalate for that person. You want to make sure that their mental health is being addressed, and ultimately you want somebody to be able to feel that they're heard and that they are receiving the support that they need. Identifying whether there is going to be somebody that needs urgent assistance, whether somebody needs like a referral, or they may need an increase in their case plan and visits and so on. Having a case plan in place as well, and whether you've noted that that case plan has kind of changed, and seeing whether there is other things that have been highlighted that could indicate that there is a decline in someone's mental health, and knowing when to make those referrals for the stage that the person could potentially be at. Emergency can be quite clearly defined if you're in a face-to-face situation, and that could be the body language of the person, or the person actually disclosing that they don't feel well and that they feel like they are going to hurt themselves or hurt others. Then obviously that would be an emergency situation, and that person would need care as soon as possible. A strength-based approach is including the customer in all decisions, because it is for the customer. You are the person that may steer this for the customer, but they have to be the person that wants to engage and wants to move forward with support in their mental health. Speak to the customer, find out what's happening, see what they would like out of their journey, building that rapport with them for them to feel comfortable to explain what they're going through, so that services can be brought in place. We can make multiple referrals, but they may not be the right referral. So having that communication and sitting down and speaking to the customer and understanding what they need, and then going by what services that you have and that you feel would be best related for what the customer is currently experiencing or going through. Having that relationship with those partners is essential, making sure that you are finding out what that service is that you're referring someone to, so that they're not going through that process of an assessment or telling their story multiple times and it being the incorrect service that you're referring to. Very strong collaboration with the agency helps, because that way you can see what programs are going, because agencies are always changing and including new programs. So understanding what's available at that time and ensuring that the referral that you're making is going to be the most adequate referral for that customer. After gaining consent from that customer, I will do this warm handover and disclose some of the information they've received to me, so that they don't have to continuously repeat their story, and they have a feeling that people are working in unison to assist them. It makes me feel that we have done the job correctly and done the correct referral, and that the customer is receiving the support that they need. So for me, that is a good feeling, because you want someone to do well. As a housing worker, you want somebody to sustain a tenancy. You want somebody to thrive.